questions focused on tuberculosis, TB, covering key concepts such as primary and secondary TB, Gone complex, miliary TB, PPD testing, and extrapulmonary manifestations. Each question includes 5 answer choices and detailed explanations for both correct and incorrect options. Question 1. Primary tuberculosis and Gone complex. A 6-year-old child undergoes a routine chest X-ray, which reveals a calcified subpleural lesion in the mid-lower lobe of the right lung and an enlarged ipsilateral hilar lymph node. The child is asymptomatic. Which of the following best describes these findings? A. Reactivation tuberculosis. B. Miliary tuberculosis. C. Gone complex. D. Rank complex. E. Pot disease. C. Gone complex. Explanation: C. Gone complex refers to the combination of a Gone focus, a primary subpleural caseating granuloma, and involvement of regional hilar lymph nodes, characteristic of primary TB infection. Incorrect choices: A. Reactivation tuberculosis typically affects the apical lobes and presents with symptoms. B. Miliary tuberculosis involves hematogenous dissemination with numerous small lesions. D. Rank complex is a calcified Gone complex indicating healed primary TB. E. Pot disease refers to TB of the spine. Question 2. Secondary reactivation, tuberculosis. A 45-year-old man presents with chronic cough, night sweats, weight loss, and hemoptysis. Chest radiograph shows cavitary lesions in the upper lobes. Which of the following best explains the pathogenesis of his condition? A. Hematogenous spread of primary TB. B. Reactivation of latent TB in immunocompromised state. C. Primary TB infection in the lower lobes. D. Hypersensitivity reaction to BCG vaccine. E. Reinfection with a different Mycobacterium species. Correct answer: B. Reactivation of latent TB in immunocompromised state. Explanation: B. Reactivation of latent TB typically occurs in the upper lobes due to higher oxygen tension, especially in immunocompromised individuals. Incorrect choices: A. Hematogenous spread leads to miliary TB, not cavitary lesions. C. Primary TB usually affects mid-lower lobes. D. BCG vaccine reactions do not cause cavitary lesions. E. Reinfection is less common than reactivation. Question 3. Miliary tuberculosis. A 30-year-old HIV-positive man presents with fever, weight loss, and generalized weakness. Chest X-ray reveals numerous small nodular opacities throughout both lungs. Which of the following best describes this condition? A. Primary tuberculosis. B. Reactivation tuberculosis. C. Miliary tuberculosis. D. Tuberculous pleuritis. E. Sarcoidosis. Correct answer: C. Miliary tuberculosis. Explanation: C. Miliary tuberculosis results from hematogenous dissemination of Mycobacterium tuberculosis, leading to numerous tiny lesions in multiple organs. Incorrect choices: A. Primary TB typically presents with a Gone complex. B. Reactivation TB affects upper lobes with cavitary lesions. D. Tuberculous pleuritis involves pleural effusion. E. Sarcoidosis can mimic TB but is non-infectious. Question 4. PPD skin test interpretation. A 28-year-old healthcare worker undergoes a PPD skin test, which shows 12 millimeter induration after 48 hours. She has no symptoms and no known TB exposure. Which of the following is the most appropriate next step? A. Repeat PPD in 1 week. B. No further action. C. Initiate isoniazid therapy. D. Order chest X-ray. E. Administer BCG vaccine. Order chest X-ray explanation. D. A chest X-ray is indicated to rule out active TB in individuals with a positive PPD test. Incorrect choices: A. Repeating PPD is unnecessary. B. Positive PPD requires further evaluation. C. Isoniazid is initiated after ruling out active TB. E. BCG vaccine is not used in the U.S. for adults. Question 5. Extrapulmonary tuberculosis. A 60-year-old man presents with back pain and fever. MRI reveals destruction of the lumbar vertebral bodies and a paravertebral abscess. Which of the following is the most likely diagnosis? A. Osteoarthritis. B. Pot disease. C. Multiple myeloma. D. Metastatic prostate cancer. E. Spinal epidural abscess due to Staphylococcus aureus. Correct answer. Explanation: B. Pot disease is tuberculosis of the spine leading to vertebral destruction and abscess formation. Incorrect choices: A. Osteoarthritis does not cause abscesses. C. Multiple myeloma presents with lytic lesions but not abscesses. D. Metastatic cancer rarely causes abscesses. E. Staphylococcal abscesses are acute and severe. Question 6. Caseating granulomas. A lung biopsy from a patient with chronic cough and weight loss reveals granulomas with central casus necrosis and Langerhans giant cells. Which of the following is the most likely diagnosis? A. Sarcoidosis. B. Histoplasmosis C. Tuberculosis. D. Wegener's granulomatosis. E. Aspergillosis. Correct answer C. Tuberculosis. Explanation. C. Tuberculosis is characterized by caseating granulomas with Langerhans giant cells. Incorrect choices. A. Sarcoidosis has non-caseating granulomas. B. Histoplasmosis can mimic TB but is less common. D. Wegener's involves necrotizing vasculitis. E. Aspergillosis typically does not form granulomas. If